At MedStory, we take privacy seriously and follow all healthcare privacy laws. Some details may be changed to protect confidentiality. The views expressed are solely those of the individual speaking and do not represent the views of their employer.
Before we begin, a quick disclaimer. This podcast discusses mental health challenges, including depression and suicide. Some content may be distressing for certain listeners. The information shared is for educational and storytelling purposes only and does not constitute medical advice. If you are in crisis, please contact a licensed mental health provider or dial 988 for the Suicide and Crisis Lifeline. You wake up. It's hard to move. Call out sick again. You cancel plans again. You tell yourself it's just a phase, but deep down, you know you're not okay. You decide to get help, but there's a problem. You call 10 clinics, 4 don't answer, 3 say they're not accepting new patients, and the rest? First available appointment is in 5 months from now.
Meanwhile, there is a mental health worker shortage, and officials say it is causing a crisis among kids and teenagers who need those services.
Yes, Joy Addison joins us with more.
The U.S. Surgeon General calls it the defining public health crisis of our time, mental health. Nearly 50,000 Americans died by suicide last year, more than any year on record. The president says we are falling short.
The truth is that this is not rare and is the reality for millions of individuals in America. Today, we're diving into a story that affects every family in this country, the crisis of access to psychiatric care, and what you can actually do about it. America is facing a mental health emergency. Estimates suggest we're short between 14,000 to 30,000 psychiatrists, a deficit that could last until 2050 without massive reform. But it's not just about the numbers. People can't afford care. Even those with insurance are drowning in out-of-pocket costs. If you're low income, forget it. You're often left waiting months or just giving up altogether. And then there's the geography. In Hawaii, for example, people fly between islands. In Florida, they'll drive from Lake City to Jacksonville just for a 15-minute check-in. Here's the sad truth. Every missed appointment, every denied insurance claim is not just frustrating, it's dangerous. We're losing people to suicide, and we're losing hope. I want to introduce you to Shariq Refai. He's a board-certified psychiatrist who's seen this struggle up close and personal, and he's deciding to do something about it.
I remember there would be patients who would fly from one island to the next to be able to see a psychiatrist because they weren't all over the place. Then when I was stationed at Texas, similar concept, people would come from the smaller towns of Texas because there was no psychiatrist available. So over and over and over, it's a matter of basically not only the access and availability, but the inconvenience that takes to be able to see somebody, and it shouldn't be that difficult. So when you talk to patients, well, why haven't you come in for your appointment, or why haven't you seen a psychiatrist?
That question led Dr. Refai to create ShrinkMD, a telepsychiatry platform designed to bring care directly to patients, no matter where they are.
They do it at their own convenience, in their own space, feel more comfortable. They don't have to be around other people, especially people who have social anxiety. Also, for people who have less time. My vision is to be available for patients across the board, across the United States, have the availability, have the access, and cost is not a barrier, and bordering states aren't a barrier.
ShrinkMD is designed around the patient, not the system. Appointments within days, not months. Access in rural towns and big cities. And pricing structures that make mental health care accessible, not a luxury. So if you're struggling or if you've been ghosted by the system, you're not alone, and you're not without options.
One of the biggest barriers is the access. Who do I call? Or not having the availability, or the next appointment being out 2 months. And so having that membership would allow you to be able to see somebody within a few days, if not even 24 hours.
We live on the richest country on earth, and yet we're ranking near the bottom when it comes to happiness. That disconnect is costing lives. Depression isn't a weakness. Anxiety isn't a flaw. And asking for help, it's not just brave, it's necessary. So if you're listening to this right now and you're nodding your head and wondering if this is you, it is. Please don't wait any longer. Find potential solutions like ShrinkMD to see what's possible when a system gets out of your way, because the care you need should meet you where you are. Thanks for listening to the MedStory Podcast, where we share the stories of the greatest minds in science and medicine. I'm your host, Spencer Locke, with a special thanks to our executive producer, Shaina May. Our music comes from Blue Dot Sessions and the Descript Audio Library. The MedStory Podcast is made possible by MedStory Studios and listeners like you. So if you'd like to support us, please leave a review. It means more than you know. And if you have a story to share or want to produce a podcast of your own, reach out to us at info@medstorymedia.com. We'll see you in the next episode.